Hey guys, welcome back for another day of our practice question series. This week we have been covering derm, musculoskeletal, psych, and men's health. So let's get into our questions for today. But as always, I like to give my intro and disclaimer so that those of you who are familiar with me, hey y'all, and for those of you who are new, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. And here we are doing a practice question series just to kind of test your knowledge on everything getting prepared for boards. But I like to give the disclaimer for my videos. They are designed for nurses and nurse practitioners to aid you in exam and board success as well as in practice. But there's no absolutes in medicines. So take it as such because we treat on a patient by patient basis, but this is to help you prepare to be successful for those exams, right? So guidelines change, but these are the ones that are currently being tested. So follow me and let's take a look at these questions. Question number 1 states, a patient presents to the office with complaints of pain to her left side, and she has since noticed some small bumps. As the nurse practitioner assesses the patient, she notices small red bumps in a dermatomal pattern to the left side of the patient's thorax. Based on these findings, how should the nurse practitioner diagnose? Is it A, trigeminal neuralgia, B, shingles, C, pityriasis rosea, or D, hives? Take a moment and tell me what you have in the comments. All right, you guys, I always tell you to read the stem of the question first to ensure you are answering what they are truly asking you, right? So the stem of this question states, based on these findings, how should the nurse practitioner diagnose? So, all right, so what are we even seeing? How do they present before we can come up with a diagnosis or a differential diagnosis? So the patient is stating that they have pain to that left side. She says she has noticed some small bumps. The nurse practitioner notes on her assessment small red bumps in a dermatonal pattern to that left side of the patient's thorax. So, I always tell you guys, think of those key identifiers. Make yourself familiar with it when you're studying things. My rule to go through assessment, diagnosis, evaluation, and treatment. Study those things in that pattern, right? And break those down so that you are quickly able to identify when a patient states it to you, when a question is presented in that fashion. Those key identifiers should quickly grab you so you can know to consider those as your differentials, right? All right. So is it A, trigeminal neuralgia? No. Although this sounds like some kind of nerve issue, it's not trigeminal neuralgia. That is more along on that cranial nerve 5, right? B, shingles. Yes. One thing you should know about shingles is it typically follows a dermatomal pattern. And if you're like, girl, what, Brittany, what does that mean? All right. So, we have cranial nerves, we have spinal nerves, and they follow a nervous system pattern. That dermatomal pattern follows that those different nerves, those spinal nerves, right? And so typically with shingles, it will go down that path. So the bumps will be in that path of that the pattern, the dermatomal pattern that the spinal nerves follow. So that's where they get that little pain because it's like neuropathy because that area is what is most affected. So that's what you will commonly see on shingles, and shingles is typically noted on like the cheek region or that thorax region. So also, y'all know, every time I tell y'all about derm, when you're looking at questions or when a patient is talking to you, pay attention to the location is going to quickly give you a map to think of. So certain things are commonly seen in certain areas, so that should also navigate your mind for the differential diagnoses. Okay. All right, next question. The nurse practitioner is explaining to the nurse practitioner student that she will need to prescribe prophylactic therapy to the patient diagnosed with gout. As the student states medications, what shows her understanding of the appropriate prophylactic treatment? Is it A, NSAIDs, B, colchicine, C, allopurinol, or D, acetaminophen? Tell me what you think. All right, the similar question states, as the student states medications, what shows the understanding of the appropriate prophylactic treatment? So they were discussing prophylactic therapy for gout. So which medication is prophylactic therapy for gout? You need to know those medications. Is it NSAIDs? Nope. Is it colchicine? Nope. Because what NSAIDs and colchicines are abortive therapy for gout, right? Meaning they have it that's going to treat it, right? The acute therapy, that acute pain. So acute symptoms, that acute therapy is your NSAIDs and colchicine. C, allopurinol. Yes, allopurinol is prophylactic therapy for gout. I always say with my Brittany's Brilliant. So if you haven't seen, go check out my video or my review book. That it has the word all in it. You use allopurinol to help them all the time, right? We give prophylactic therapy to cover them, and then we use the NSAIDs and colchicines for those acute phases, so that those outbreaks to treat it. And I say we use those. Think of C and N to cut the pain now. Okay. Question number 3. The nurse practitioner is teaching the NP student on SSRIs. They are now discussing who should not take SSRIs. Which patient below should not receive an SSRI? Is it A, a 32-year-old female patient with a history of major depressive disorder? B, a 47-year-old male patient with generalized anxiety disorder and has a history of diabetes? C, a 42-year-old female with panic disorders, generalized anxiety, and anorexia? Or D, a 27-year-old male with social anxiety and OCD? Take a moment and tell me what you got in the comments. All right, you guys. So the stem of the question states which patient below should not receive an SSRI. For one, we read the stem for purposes just like this, so that you can slow down and realize that it's saying not. Right? It's telling you which one should not receive SSRIs. So don't slip up and make that mistake. But this is an instance where reading that stem is beneficial because it's slowing you down, and you knowing that you need to consider the factors that are not utilized when you should not give an SSRI, right? So let's break it down. A 32-year-old female patient with a history of major depressive disorder. Yeah, we would give that because what? Major depressive disorder, that's SSRI is a first line therapy. So yeah. B, a 47-year-old male patient with generalized anxiety disorder and has a history of diabetes. Yep, you can give it to them. SSRIs are first line therapy for patients with generalized anxiety disorder also. C, a 42-year-old female with panic disorders, generalized anxiety disorder, and anorexia. Um, SSRIs are utilized for panic disorders and generalized anxiety disorders, first line therapy as well, right? But you should pick answer C because of the anorexia. You do not want to give patients SSRIs if they have anorexia, or patients like the elderly population that may be malnourished or are having issues with their appetite, because SSRIs depress the appetite. So you don't want to cause additional suppression of that appetite, do you? So C is your best answer. But let's look at D too. D says a 27-year-old male with social anxiety and OCD. Nope. Those are also first line therapy. SSRI also first line therapy for those. So remembering, and I have a video on SSRI, so go check it out. But SSRIs are first line therapy for our major depressive disorders, our generalized and social anxiety, our panic disorders, those OCDs, things of that nature. But you remember that with SSRIs, people that have appetite issues, who may have anorexia, who may be malnourished, you don't want to give those because it suppresses the appetite. You want to not give it in conjunction with MAOIs. You want to give them at least 2 weeks, like a 14-day span at minimum, before you start it after an MAOI has been stopped. You also know that SSRIs can cause a decrease in libido, so and ED. So just think about all of those things when you're thinking about SSRIs. But if you need some more information, go check out that SSRI video. All right, and the last question: the nurse practitioner student is inquiring about prostate cancer and when to biopsy. What is the appropriate response of the nurse practitioner? Is it A, that the patient has chronic dribbling, B, a family history of prostate cancer, C, a PSA greater than 10, or D, a PSA greater than 4? Tell me what you think in the comments. All right, so the stem of the question states, what is the appropriate response to the nurse practitioner? So the NP student was asking about prostate cancer and when to do a biopsy. So which one is the correct answer from the nurse practitioner? Is it that the patient has a chronic history of dribbling? No, that doesn't warrant biopsy. They may have BPH, but or other prostatic issues, but it doesn't warrant a biopsy, not solely off of the dribbling. Family history of prostate cancer. Yeah, you want to do testing on those patients if warranted, and go take a look at when you do your PSAs and everything. But that does not warrant solely for a biopsy. C, a PSA greater than 10. That's your answer. PSA greater than 10 off top requires you for a biopsy. A PSA greater than 4, no, that's where it's beginning to be abnormal. That's where you see that abnormal and you start to come with your diagnosis and want to look further. But that does not warrant the biopsy. The when it's greater than 10, that's when you know to immediately biopsy. Okay. All right, you guys. I hope that you found these helpful. Be sure, as always, to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you guys meet me back here. Next week, we'll be continuing our practice question series as we have all month long. If you haven't had a chance to go check out the other ones, please do so. And as I always tell y'all, make sure if you have difficulty with certain areas or if you want me to elaborate on something more, put it in the comments and I'm happy to do so. All right. Bye, y'all.